Hi students, or I would say future doctors. I am Dr.Priyanka Pandey, lecturer in the Department of Conservative Dentistry and Endodontics. Okay, so basically welcome to ENAMEL-HEROES, which is the name of the program. So basically I am here to extend my horizon of knowledge and help you people, to ease your life a little bit, I guess. So basically welcome to the program that is ENAMEL-HEROES. Now I'll be telling you certain things about the what we call the motive of you people to coming here. So basically I have created this program to help students which come to me with lot of queries. Ma'am, kahan se padhna hai, what are the books, and how we're supposed to write question answer in exams, and lot more things. Okay, so I believe in smart study rather than hard study. It is very important for you people to know what are the books, what is the content that is authentic, and it should come from the authentic sources which you are supposed to write in your exams, be it your internals, be it your professionals, and even in your viva voice, right? So here I'll be compiling you with all the content that is authentic and that is required for you people to write in the exams and answer the questions. Okay, so I'll be covering certain topics. I mean, obviously the entire anatomy. This is just a first lecture, or I would say a demo for you people to know what basically we are here, right? So I'll be giving you the data, I mean the content topic wise, and I'll be teaching you the entire content. It will also include diagrams, and these diagrams are from the authentic books like B.D. Chaurasia, Halim, Inderbir, and so on. Okay, depending upon the topics from which book I have been extracting, right? And along with the topic also, and at the end of the every chapter or every topic, I'll be telling you important questions, how to form question answers, what to write if the question comes in 5 number like short note form, or in 3 marks, or be it in 10 marks, 15 marks, whatever the long question takes, right? So let's get to the topics. So basically this is the first demo lecture I have created for you people to know how I basically work here in this platform. So the content of this chapter or the topics of this lecture includes, the first thing is deep cervical fascia. This is a very famous, very important topic which I'll be covering, and it is the most important topic of the people who set anatomy exam, both for internal as well as for professional. Its modifications and of course the cavernous sinus. Okay. So basically, what is deep cervical fascia? It is also known as fascia coli. Fascia coli क्या है? इसका दूसरा नाम. What is the another name for deep cervical fascia? Is a fascia coli. And students, let me tell you one thing. The content that I'm showing you, that I'm teaching you, this is the exact content you can write in your exams, be it internal, be it professionals, and I'm assuring you, I'm guaranteeing you that it will fetch you a lot of marks. I mean really good marks in your internals as well as in your professionals. Okay, so let's get back to the topic, that is deep cervical fascia. It is also known as fascia coli. There are areas that are devoid of it, including face, but parotid gland exception है. फेस में डीप सर्वाइकल फेशिया नहीं होती है, लेकिन पैरोटिड ग्लैंड इज वन एक्सेप्शन. इट हैज डीप सर्वाइकल फेशिया. और कहाँ पे नहीं होती है? एंटीरियर एब्डोमिनल वॉल. इट फॉर्म्स वेरियस फेशियल स्पेसेस इन द नेक. It also provide capsules to the glands. Capsules to the glands means it protect the glands. It provides a protective covering to the glands and invest the muscles in the region. Forms a protective sheath around neurovascular structures. You know what are neurovascular structures? It includes spine, it includes your all kind of nerves and everything. Okay. Now this is the diagram you're supposed to make if the question comes of deep cervical fascia. अगर question deep cervical fascia पे आता है, then you're supposed to write this content along with the diagrams. And as everybody says, and anatomy is diagram, diagram is anatomy. So I hope you know what I mean, right? So as you can see, the outermost layer, the circle, it basically has 3 layers. The outermost layer is the investing layer. जो circle दिख रहा है black color का, the outermost layer is the investing layer. And then comes the inner layer. As you can see in the image, the pretracheal layer. The inner layer or the second layer is the pretracheal layer. Now comes, as you can see, the blue color circle inside this big black circle. This is the prevertebral fascia. Okay. So if we come to the pretracheal layer, its outer layer it has 2 layers. It again has 2 layers. The outer layer is the visceral layer. It encloses thyroid gland, and the inner layer is the muscular layer. It encloses strap muscles. Okay. What are strap muscles? You must be wondering. Strap muscles are basically the muscles of the neck. Okay, that controls all the activities in the neck region. Okay. And this is the diagram you're supposed to make in your exam if the question comes from deep cervical fascia. And as you can see, the two main muscles that it includes is the sternocleidomastoid and the trapezius muscles. Okay. Now the modifications of deep cervical fascia. The modifications are very important, and in this modification, as you can see, the two pop-up topics. I mean the pop-up topics that definitely comes as a short note in your exam. The first is the investing layer, pretracheal layer, prevertebral layer, carotid sheath, buccopharyngeal fascia, and pharyngobasilar fascia. So these are the modifications of deep cervical fascia. But out of these modifications, there is 2 layer or the 2 modifications that very popularly and very frequently they come in exams, both in internal as well as in professionals. So which of them are very important? First is the investing layer. They can ask a separate short note of 5 marks or 3 marks or whatever for this question, for this investing layer. Investing layer comes as a separate question. It can also come as a separate question as a short note form, be it for 5 marks or be it for 3 marks. Okay. And second, which is most important modification, is carotid sheath. It is also most frequently asked in your exams. Okay. We'll be studying separately about investing layer and the carotid sheath. Carotid sheath. Carotid sheath क्या होता है? It is a tubular condensation. Tubular समझ रहे हैं? Tube like. It is a tubular condensation of deep cervical fascia around का मतलब किसके around? Tubular sheath होती है किसके around होती है tubular sheath? Around common carotid artery, internal carotid artery, internal jugular vein, and vagus nerve. Okay. Carotid sheath is a tubular structure. Okay. एंड ये जो ट्यूबुलर स्ट्रक्चर है, इसके अंदर ये कंटेंट है इसका, कॉमन कैरोटिड आर्टरी, इंटरनल कैरोटिड आर्टरी, इंटरनल जुगुलर वेन एंड वेगस नर्व. नाउ आई विल टेल यू द डायग्राम, आई विल शो यू द डायग्राम. दिस डायग्राम इज वेरी इंपॉर्टेंट. इफ क्वेश्चन कम्स ऑन कैरोटिड शीथ, यू आर सपोज्ड टू ड्रॉ दिस डायग्राम. ओके. So as I've told you, it is a tubular structure. You can see the tube. The green colored outline is basically the tube, and inside the tube you can see this blue line or the blue tube-like structure. This blue tube-like structure is the internal jugular vein. As you know, blue color depicts vein, red color depicts artery, and yellow color depicts nerve. Okay, so this blue structure is the internal jugular vein. This red structure, as you can see, students just see from bottom and then frequently go upwards. Okay, as you can see, this red structure is a common carotid artery, and at certain point it is splitting into the two and forming internal carotid artery and the external carotid artery. And students, here comes the star point. What is the star point? The external carotid artery is not a part of a carotid sheath. Okay, I'm repeating it again. The external carotid artery is not a part of carotid sheath. So if the examiner asks a question in Viva that is the external carotid artery is a part of a carotid sheath, what you're supposed to answer? No, it is not a part of a carotid sheath. Okay, so the figure number A is a surface view, and now comes to the figure number B. It is a sectional view. Students, do you understand what is sectional view? Let me tell you. Let me simplify it for you. If you cut this tubular part from mid or from anywhere into the sections, certain sections, then if you see under the microscope, this is the structure that you see. this green color outline, this is the carotid sheath, this is a sectional view, and inside it the red circular structure is the common carotid artery. The red circular structure is the common carotid artery, and this blue circular structure is the internal jugular vein. And as you can see the black dot in it, this is the vagus nerve, and the two yellow dots on the boundary of the carotid sheath, you see these are ansa cervicalis. And students, do you know what is ansa cervicalis? It is basically the loop of nerves. ये nerves का एक loop होता है in the neck that controls certain neck muscles. This is the loop, मतलब एक loop है, loop of nerve, एक network है nerves का in the neck region that basically controls the certain muscles in the neck region. Okay, and then you see the star shaped structure. This is a sympathetic chain and the prevertebral fascia. Okay students, so if the questions comes on carotid sheath, what is all you're supposed to write from here? This is the content. Carotid sheath क्या होता है? It is a tubular condensation of deep cervical fascia. And इसका क्या content होता है? क्या इसके अंदर carotid sheath के अंदर जो tubular structure है उसके अंदर क्या क्या होता है? So basically common carotid artery, internal carotid artery, internal jugular vein and vagus nerve. And this is the diagram. The diagram both A as well as B you're supposed to draw in your exam. And it is very important to draw color diagrams. Okay, do you understand what I mean by color diagram? Suppose you are making a vein, it is supposed to be blue in color because there is certain colors that is designated to certain objects or certain structures. Okay, so vein is in blue color, artery, if you are drawing artery, is in red color, nerve is in yellow color. And if you're drawing suppose ligaments, it is in green colors, muscle, it is in brown color, and so on. So whenever you make anatomical diagram, it has to be well labeled as well as colored. Okay students, now what are the relations? Relations means attachment. Attachment क्या होता है? Carotid sheath का attachment क्या है? Anteriorly किससे attach होता है? Posteriorly किससे attach होता है? Okay, so ansa cervicalis, as I have already explained you, it is a loop of nerves in the neck that controls certain neck muscles. So it is adherent to anterior wall, means attached to anterior walls, and sympathetic chain, it is attached to the posterior wall. As you can see in this figure, ansa cervicalis, can you just see where is ansa cervicalis? Since it is in the anterior part of the carotid sheath, so it is attached to the anterior wall. And as you can see, the sympathetic chain, this is in the posterior region of the carotid sheath, so it is attached to the posterior wall. Okay, so this comes the end of the topic carotid sheath. If the questions come on carotid sheath in short note form, you're supposed to write this. Okay, you're supposed to write the entire content from here. These two diagrams, the well labeled color diagram has to be there in order to get good marks. Then relations. Now comes the second modification of the deep cervical fascia. As I have told you, there are two modifications which are very important for exam purpose and they are very frequently asked. They can ask you a long question also, like write a long question along with its modifications, relations, well labeled diagram of deep cervical fascia. Then you are supposed to write this entire topic, these entire slides along with the given diagrams that I have shown you. Okay, now comes investing layer. Investing layer क्या होती है? This layer encircles the I will be showing you the image of the investing layer so that you could just make out what is basically investing layer, where it is, where it lies, what its function is and everything. Okay, just for now, just focus on the content and just focus on the slide first. This layer encircles the neck. This layer encircles, ये neck को encircle करती है कैसे? Like a collar. This layer encircles the neck like a collar deep to platysma and superficial fascia. Okay, this layer means investing layer. It encircles the neck like a collar, जैसे शर्ट का कॉलर होता है ना, exactly the same way. Deep to platysma. Platysma क्या है? Platysma is a muscle in the neck and superficial fascia. Attachments. See students, if the question comes, you're supposed to write everything under heading. It is very important to write relations, attachment, boundaries, floor, roof. So everything has to be in the हेडिंग फॉर्म, अटैचमेंट लिखना बहुत इंपॉर्टेंट है. देन रिलेशंस क्या है, इंटीरियरली किससे अटैच है, पोस्टीरियरली किससे अटैच है, फ्लोर में किससे अटैच है, रूफ में किससे अटैच है. सो आई एम जस्ट टेलिंग यू दीज आर द हेडिंग्स और द पॉइंटर्स अंडर विच यू आर सपोज टू just form your entire answer. Okay, so this layer encircles the neck like a collar deep to platysma and superficial fascia. ये क्या हो गया? This is the introduction. It means you are telling, you are defining the investing layer. Investing layer होती क्या है? And now you are heading to the next heading, which is attachments. You are also supposed to write the attachment. Superiorly किससे अटैच है, inferiorly किससे अटैच है, anteriorly किससे अटैच है, and posteriorly किससे अटैच है. So let's see. Superiorly, external occipital protuberance, superior nuchal lines, mastoid process, lower border of mandible from behind. Okay, so these are all the landmarks or the structures to which investing layer is superiorly attached. Okay, now inferiorly, spine of scapula. I hope you can make out where scapula is. I'll show you in the figure, don't worry. Spine of scapula, acromion process, upper aspect of clavicle, jugular notch of manubrium, sterni. So these all are the structures to which investing layer is attached inferiorly. Okay. Now anteriorly, symphysis menti and hyoid bone. Posteriorly, ligamentum nuchae and C7. Okay. See students, it is also very important to remember that when you are answering any question, either for internal or professional, it has to be in the point form. Okay, you're not supposed to write the entire paragraph. Nobody is bothering to just see your answer. It is very important to form your answer, to write your answer under heading. There has to be content, then proper headings, and inside the headings there should be answer in the point form. You are not supposed to write answer in the paragraph form. Okay, now this is the figure that you're supposed to make if question comes on investigation. Okay, I'll show you. Okay students, so can you see this figure? So this bone that you can see, this is sternum. Sternum समझ में आ रहा है? Sternum कौन सी bone है? This is the chest bone, the sternum. And these two structures, you can see, you can appreciate these two structures. These two structures is your clavicle bone. It is connected to the sternum, and the structure above this sternum and also attached to the clavicle, this structure, this is the suprasternal space. Why it is called suprasternal space? Because this is sternum and this structure is exactly above the sternum, and hence name suprasternal space. This structure is also called burn space. What called? It is called burn space, and this is very important. They can ask you separately, what is burn space? Write the contents of burn space. So it is very important. Burn space क्या होता है? In the same way, as you can see, this bone, this is clavicle. Okay, this is clavicle, and above the clavicle there is a space. This is called supraclavicular space. Why it is called supraclavicular space? Because this bone is clavicle and this space is above the clavicle, so it is called supraclavicular space, right? And these are the, and it is also very important to know what is the content, what are the contents of this burn space. These are the contents of burn space. burn space के अंदर होता क्या है, ये जो space है इससे क्या पास होता है, क्या होता है. It has interclavicular ligaments. This is very important, students. Just focus here. Burn space separately comes as a short note. Okay, what are the contents of burn space? First is the interclavicular ligament, then jugular venous arch. Jugular venous arch होता है. थर्ड क्या होता है? It also has a sternal head of SCM. SCM क्या होता है? SCM is basically sternocleidomastoid. It has a sternal head of sternocleidomastoid muscle. Okay. Now, follows the rule of two. Follows the rule of two. What basically it means? It means ये जो हमारे investing layer है, it basically encloses every two thing. Means it encloses two muscles, two glands, two spaces, two ligaments, and two pulleys. Okay. So you're supposed to write as it is. What? It follows the rule of two. And see, student, this is the content from the authentic sources. You can write as it is in your exam, and in order to get really good marks. Okay. And you're supposed to write in this form only, in this pattern, like pointers form. Point में लिखना है हर चीज, under certain headings लिखना है, and it is also very important to include all the headings in your answer. Okay. So what it follows the rule of two. Means it encloses two muscles. What are the two muscles? SCM. SCM means sternocleidomastoid muscle, trapezius. And it encloses two glands. दो कौन से glands हैं? Means it encloses parotid gland, submandibular gland. It encloses two spaces. As I have already explained you with the figure, with the really good diagram, burn space, which is also called suprasternal space. Okay. And supraclavicular space. And you also know the what are the contents of burn space. Burn space separately can come in a short answer form. Okay. And it encloses and forms two ligaments. What are the two ligaments? Stylomandibular ligament and sphenomandibular ligament. It forms two pulleys. One is digastric, one is missing, and the next pulley that it informs or encloses is omohyoid pulley. Okay, students, omohyoid pulley. First is the digastric and second is the omohyoid pulley. So here we come with the end of the topic, that is deep cervical fascia. The entire means it including its modifications, and out of those modifications there are two modifications that were really very important. First is investing layer and second is carotid sheath. So till here we are done with the topic, that is deep cervical fascia. Now let's move to the next topic, and which is the last topic for today, that is cavernous sinus. Cavernous sinus क्या होता है? See, there are other sinuses also, but I want you people to only study that kind of stuff, that kind of topics that actually comes in exam. I don't want to make you study the entire book. See, the entire book is not important. Okay. There are only very selective topics or very selective things that you are supposed to study, in order to score really good marks. So this cavernous sinus is one of those topics. Okay. You are not supposed to just learn, go through the entire sinuses. No, that is not smart study. Hard work करना है, but smartly. सब कुछ नहीं पढ़ना है बैठ के. You should know by the time you have to figure it out what is really important for you for exam purpose. You're not supposed to mug up everything, right? So our next and the last topic for the day is cavernous sinus. First of all, intro. Cavernous sinus is a paired sinus. This is not a single sinus. This is a paired sinus. अब इसकी location, where it is located? It is located either side of the body of sphenoid and sella turcica in the middle cranial fossa. It is very important, student, to write as it is. It includes everything: the intro part, the location, the relation, the attachment, floor, roof, contents and everything you are supposed to write in the same pattern also, means in the sequence is also supposed to be the same. So cavernous sinus is a paired sinus located either side of the body of sphenoid and sella turcica in the middle cranial fossa. It is spindle in shape. This is the shape of the sinus. कैसा होता है? Spindle shape. It is 2 centimeter long and 1 centimeter wide. Now, what are the relations? Medially, pituitary gland, sella turcica, sphenoidal air sinus. Laterally, oculomotor nerve. Third, it is a third nerve. Trochlear nerve, it is a fourth nerve. Ophthalmic nerve, maxillary nerve. Uncus क्या होता है? It is a temporal lobe. Okay. Superiorly, ICA. What is ICA? Internal carotid artery and optic chiasma. Inferiorly, it is foramen lacerum. Okay. So these are the relations of cavernous sinus. This is a diagram, student, that you're supposed to make if question comes of cavernous sinus. This is the coronal section through the middle cranial fossa, showing the relations and the contents of cavernous sinus. Okay. Okay, now you can see clearly. Okay, students, so this is the diagram of the cavernous sinus. As you can see, the first yellow color structure, this is optic chiasma. This is optic chiasma. This red color structure is the internal carotid artery. Okay. And this structure is the stalk of hypophysis cerebri. Students, as you can see, this cave-like structure, cavernous basically means cave. This cave-like structure, this is cavernous sinus. And you can appreciate the nerves here: oculomotor nerve, trochlear nerve, ophthalmic nerve, maxillary nerve. And this red color structure, this is the internal carotid artery. This yellow color structure is the abducent nerve. And here comes the mandibular nerve. And these two big spaces, as you can appreciate here, is the sphenoidal air sinuses. So this is a diagram that you are supposed to learn and mug up. There is nothing in this that is difficult. You can easily write, you can easily draw. This is very easy diagram. First of all, you're supposed to make like this. It's very easy peasy. Very easy, extremely easy. You can easily make. I'm making a rough diagram quickly for you to understand better. Right? Very easy. ये बन गया optic chiasma. Okay. These are the internal carotid artery. This is the hypophysis, stalk of the hypophysis cerebri. And now let's make these are sphenoidal air sinuses. Simple diagram. Nothing difficult. It just seems it is difficult, but actually it is not. These are the sinuses. Cavity-like structure is the sinuses. Okay. I am drawing this side also. Sinuses. This cavity-like structure is a sinus. Okay. Very easy. Very easy. Now let's form nerve. This is oculomotor nerve. This is trochlear nerve. This is ophthalmic nerve. This is maxillary nerve. Okay. Here is a mandibular nerve. Now let's form arteries. This is internal carotid artery. On both sides, let's draw. Am I missing anything? No. Okay, the majority of the things I have already drawn. See how simple it is. It just seems very difficult, but you know, when you start drawing it, when you start studying it, it is very simple. Okay, students? So we have covered the intro of the cavernous sinus. Cavernous sinus होता क्या है, इसकी location क्या है, what are its relation, its diagram, and now we have reached extent. Extend means anteriorly how long it is extended and to which structure it has been extended. Anteriorly and posteriorly. So anteriorly it is extending up to superior orbital fissure, and posteriorly it is extending up to the apex of petrous temporal bone. Okay. This is a diagram that you can make in the exam if the question comes in a short note form for 5 marks. If the question comes in a 3 marks type, you can just make this diagram. You can just skip this diagram, but you cannot skip the extent. You're supposed to write extent. Now it is very, very, very important. Star mark point. Incoming channels or the tributaries of cavernous sinus. Cavernous sinus के अंदर किसकी ट्रिब्यूटरीज आती हैं? व्हाट आर द इनकमिंग चैनल्स? ऑर्बिट से क्या आता है? ब्रेन से, मेनिंजस से. OBM याद रखो. जस्ट रिमेंबर OBM. ऑर्बिट. व्हाट कम्स? सुपीरियर ऑप्थेल्मिक वेन, inferior ophthalmic vein, central vein of retina. Okay. And brain, what are the incoming channels? Superficial, middle cerebral vein, inferior cerebral vein. And in meninges, sphenoparietal sinus and middle meningeal sinus. Okay. So these are the incoming channels of cavernous sinus. So if we have talked about the incoming channels, why should we leave the outgoing channels? So here comes outgoing channels of cavernous sinus or the drainage. This is superior petrosal sinus, inferior petrosal sinus, and superior ophthalmic vein. This is basically a valveless vein. Okay. An external examiner can ask a question, which is the valveless vein that is basically the outgoing channels of cavernous sinus. So what is supposed to answer? It is superior ophthalmic vein. This is a diagram for the superior ophthalmic vein. As I have told you, it depends on the situation, that if a question comes in a short note form. Short note can also be 2 types, like a 5 mark question or a 3 marks question. So suppose the question comes in a 5 marks form, you're supposed to draw this diagram also. You cannot afford to skip any of the diagrams. This diagram is really very easy. It seems like very difficult or very confusing, but no, it is not. You can easily mug up this entire diagram. It's very simple. I'll just help you out for the diagram. See, this cave-like structure you can see. This is the cavernous sinus. Okay. This A here depicts anterior border, P depicts posterior border. I am drawing it for you. You're supposed to start from here. Okay. This is cavernous sinus. Then draw one tributary from here. This is superior ophthalmic vein, this is inferior ophthalmic vein, and this is central vein of retina. और ये क्या बना दिया हमने? ये बना दिया हमने sphenoparietal sinus. Simple, easy. This is inferior cerebral sinus, inferior cerebral vein, I'm sorry. This is superior and middle cerebral vein. See, this cave-like structure is a cavernous sinus, and inside this you're supposed to draw one inferior cerebral vein, one superior and middle cerebral vein. Okay, now let's just extend this diagram. Okay, easy. This is a network-like structure I'm making. Simple, done, dusted, easy. Let me draw this. Okay, easy. See, these circular structure, this is jugular foramen. Okay, jugular foramen. This big circular structure, this is foramen magnum. And this yellow color thing you can see, this is, which is not so straight, is a straight sinus, and this is transverse sinus. This is superior petrosal sinus. This branch like structure is a basilar venous plexus. Plexus means a branching. Okay, and this is your jugular foramen. See how simple it is. It is very, see, diagram seems to be very difficult when you are not studying it, but when you, once you have gone through the entire diagram, it is very easy. Once you draw it, just take pen, paper and draw the diagram. It becomes easy. Okay, PYQ, as I have told you, along with every topic, what is important, what comes in 10 marks, what come in 5 marks, what comes in 3 marks question. But let me summarize it for you. सो PYQ क्या है इस टॉपिक से जितना हमने पढ़ा. What can come in long note? Deep cervical fascia, along with diagrams. Obviously, anatomy is diagram, diagram is anatomy. This topic, this question can come in long note. It could be in 10 marks question or 8 mark question. Okay, in short note types, for 3 marks also, for 5 marks also. They can ask you carotid sheath, they can ask you separately investing layer, see, it can come in 3 marks also, it can come in 5 marks also. This can come in 3 marks also, this can come in 5 marks also. So it is very important for you to know, if the question has come in 3 marks, you have a limited time, the 3 hours, and you have to attempt at all the questions. So what are the things, what are the content which you should include in your answers, and what you can skip? This is also very important. Suppose the question is coming in a 3 marks form, you're supposed to write everything in short. For once, you can skip a little bit. A content form means the writing text form, but you cannot skip diagrams. Student, it is very important. Star mark point. You cannot skip what? Diagrams. Okay? You cannot. Now what else? Very important question. How can I miss? Star mark question. Triple star. Cavernous sinus. See, there are other sinuses also, other than this cavernous sinus, but this is really very very important. This question comes frequently. They frequently ask in internal also, and obviously professionals also. Okay, so these are the things that we have covered in this topic, or I would say a demo class. I have created this demo class for you people to just go through it and just extract important data which is important for you, for your friend. Maybe you could just share a word with your friend. This will help you not in your exams, but also in future also, if you're preparing for NEET or any other, for that reason, professional or exams. So here, with all my capabilities, with all my knowledge that I have shared with you, I've explained you everything which is important for you, how to write answers, how to form, how to curate answers, what all are the diagrams, and under which heading, what content you're supposed to write, how much you are right, if it is coming for 3 marks, if it is coming for the 5 marks, and if it is coming for the 10 marks, what all are the content you're supposed to include, 5 marks के लिए क्या exclude करना है, 3 marks के